If you don't know what is psychotherapy, psychotherapy or talk therapy is a group of treatment techniques that can help you identify and change disturbed emotions, thoughts, and behaviors through having conversations with a mental health professional. Psychotherapy can help with several different issues, ranging from stress and relationship issues to mental health conditions. It may be used alone or in combination with medication. The terms counseling and psychotherapy are being used interchangeably, however, there is a difference between them. Counseling is mainly a brief treatment that targets a specific symptom or situation, such as marital or family issues, while psychotherapy is a longer-term treatment that deeply understands the details of someone's issues or a mental health condition. Is psychotherapy really effective? To answer that question, we have to mention that most medication studies compare the outcomes of medications to placebos such as sugar pills. Based on this, at least 75% of the reduction in depressive symptoms with antidepressants is not due to the active ingredients in the medication, but actually, it is due to the client doing something actively and having confidence in the helpfulness of the treatment that is prescribed by a reliable psychiatrist. So it's not just the medication. The mental condition of the person taking the medication is critical. Psychotherapy is more cost-effective. It may be more effective in the long term and more enduring compared to medication. It leads to fewer relapses of anxiety and mild to moderate depression than using medication alone. There are several types of psychotherapy. The choice of therapy type depends on your particular condition. Different types may be combined to achieve better results. The first type is cognitive behavioral therapy, which is a structured, goal-oriented type of psychotherapy, used to manage mental health conditions and emotional concerns and teach you healthier patterns of thinking and behavior. Dialectical behavior therapy is based on cognitive behavioral therapy, but adapted specifically for people who experience very intense emotions. To achieve a balance between validation or acceptance of who you are and your challenges and the benefits of change. Interpersonal therapy is a short-term form of therapy. It helps you understand underlying interpersonal issues like unresolved grief, changes in social or work roles, conflicts with others, and issues relating to others. Psychodynamic therapy is based on the idea that behavior and mental well-being are influenced by childhood experiences and the unconscious repetitive thoughts or feelings that are outside of your awareness, to improve your self-awareness and change old patterns. Other types of psychotherapy include animal-assisted therapy, that involves working with dogs, horses, or other animals to feel comfort, to have better communication and help cope with trauma. Creative arts therapy involves the use of art, dance, music, and poetry in combination with talk therapy for better communication. Play therapy specifically helps children identify and talk about their emotions and feelings through play. Supportive psychotherapy improves your ability to cope with stress and difficult situations. So who needs psychotherapy? Psychotherapy can benefit anyone who's struggling with life's challenges, excessive stress, adjusting to a new life situation or medical condition, or having a mental health or behavioral condition. All age groups can benefit from psychotherapy, including children, adolescents, and adults. The following 12 signs may indicate that you need psychotherapy. If you have a negative mood most days, losing interest in things that you once enjoyed, feeling overwhelmed by life affecting your mood and daily functioning, losing control of your emotions and life, feeling anxious and having intrusive or racing thoughts. If your eating or sleeping habits have changed, having problematic habits such as excessive drinking, drug use, gambling, or other risky behaviors. If you experienced physical or mental trauma such as a car accident, the death of a loved one, or sexual assault. Persistent low self-esteem and self-confidence. Persistent issues with relationships with a partner, family member, or co-worker. Having a hard time dealing with stress related to work, family, or school. Withdrawing from social relationships or social activities. How long will I need psychotherapy? Psychotherapy can be short-term for a few sessions, dealing with immediate issues, or long-term for months or years, dealing with mental health conditions or complex issues. A study showed that people who participated in psychotherapy improved after 8 sessions, and 75% improved after 6 months. The number and the frequency of psychotherapy sessions you need depend on factors such as your mental health issues, the severity of your symptoms, how long you've had symptoms or mental health issues, how quickly you make progress toward your treatment goals, the level of stress you're experiencing, the level of interference with daily life activities, support received from family members and others, cost and insurance limitations.